I represent Crane Global Solutions Limited. We are predominantly a product house in healthcare IT space. So healthcare IT is the only vertical that we operate in. We are part of a large diversified group called Crane Group. We are a member of NASSCOM, ISO 9001, 27001 company. We truly believe that we have an integrated end-to-end solution which converges processes from clinical, operations and back office. We did not look at an HIS or an HMIS or a CIS separately. We just looked at a complete workflow or a value chain in a healthcare provider and then build a solution end-to-end on top of that. So we kind of decompose the whole processes to a transaction level and then build an integrated solution. So even though it is integrated, but it's still modular because in any typical implementation, from a risk mitigation perspective, and then from an organization change management perspective, you would like to first probably do operations first and then move on to clinical. So the application actually allows you to do that. So we are tied up with a Government of India organization called PEC, who are our partners for healthcare for India and Africa. Similarly, Andhra Pradesh Technology Services, they are our partners for all ICT-driven initiatives for state governments. We have two products in our stable. One product is actually on the SAP platform. We all know that SAP are the world leaders in business solutions, and we are the preferred partners for SAP in healthcare space in India. The other product is on the IBM platform. So IBM is our partner not just from a product perspective but also hardware, cloud offering and things like that. Fuji is our PACS partner, but our product is actually agnostic to any PACS. CMP Medica are one of the large online prescription support softwares. So they are our partners for prescription decision support system. This is a sample of our client list. So if you can see here, it includes some government hospitals and then some large corporate hospitals like your Dr. Naresh Trehan's hospital in Delhi. The way we look at our application and our implementation is that we go by the key performance indicators. It's not that our product provides certain functionalities and that is what we try and force fit it in a particular implementation. We will look at that at the end of the day, what are the key performance indicators of that particular program, and that is how the entire program will run. So it will actually start with defining the key performance indicators and then understanding how we're going to measure each one of those key performance indicators, and then we go around and implement the program that way. This is the solution architecture. So like I said, the beauty of the whole application is that it's a very integrated solution. You don't have to buy a world-class ERP separately and a world-class HIS separately and then having the headache of not just interfacing it during a project but then ongoing support year after year. So if you look at the solution architecture here, like I said, we have two products. So our SAP-based product, the backend is the SAP ERP, so your materials management, finance, human capital management, equipment maintenance, all those functionalities happen in the backend ERP. And then on top of that is the complete flow, which is from a healthcare provider space. And it's an integrated solution. There is no interface at all. So anything that a user does in a particular user interface screen, the backend ERP gets updated automatically. And that is the unique, I would say, value proposition of the solution that we have. Now the IBM one is also open source. So what it means is that this particular product is actually agnostic to any kind of an application or database. So, so basically the two separate products, one which runs on SAP and the second is which is agnostic to any application or database. The technical architecture, so it is very much web enabled. The platform itself is very unique because you must be knowing that the way databases are moving, they are moving away from the traditional RDBMS and actually moving towards a high-speed in-memory computing. So what that high-speed in-memory computing means that you don't only have to get your analytics in a high speed, but then you should have the ability to process large volume of data even in a transaction. So for example, you in a OPD scenario, in case you want to get your doctor to have a look at the EMR of a patient, before doing a diagnosis. Now your traditional RDBMS systems, they actually do not give that computing power to be able to retrieve that kind of a data and present it in a meaningful manner for a doctor to take his decision. But then for your in-memory computing, that is a possibility. So our application runs on that SAP HANA, which allows you to do that kind of a transaction. You can interface with not just all HL7 compliant equipments, but then also your old equipments which are on RS-232 ports. You'll be able to leverage the investments that you've already made rather than having to scrap it. We actually believe, and we say that there are 10 tenets of typical challenges in such large kind of a program, and we think, as the owners of the program, these are the 10 challenges that you should really look at and probably find a solution. We have the solution for it and would be glad to discuss it with you at a later stage. So first and foremost is obviously deciding on the application. Now, the typical about COTS versus open source, that's obviously one of the key decision points, but then also the robustness and scalability of the whole application. How robust is it? Can it handle that kind of a voluminous data that is obviously going to be generated from a large program like this? Second is in terms of scalability. So technology is always evolving, right? How do you ensure that what you are investing in now is going to hold you good for next 5 to 10 years, right? So you need to look at an application which is going to be ready to adopt all the new technology advancements or evolvement that is going to happen over a period of time. And third, like I said, was in computing, in memory computing. That is the ability to give your, each user of the system, give him that kind of data which helps him take decisions. So basically when you say decision support system, your decision support systems are going to be meaningless if the system does not allow you the capability to process that kind of large data and then give you meaningful information to take a decision. So I think this is the first challenge and the first key parameter that you have to consider. Second is in terms of whether the application is services oriented architecture, or whenever you start using any third party system, do you have to interface it with this particular application, or is it going to be just plug and play on a services oriented architecture? So I think that's a very important point, because if you don't consider this, your overall cost of support is going to go up very tremendously. Third is obviously the flexibility of that application to be deployed in either a centralized or a decentralized manner. Now, you could have a combination of that. So probably you may decide that my back office operations, I can do it in a centralized architecture. But my front office application, which is like mission critical, that I would want to do it in a decentralized manner. So your overall solution should give you the capability to not just have a either or, but then a combination of centralized and decentralized architecture flexibility. Fourth is multi-tenancy. Now, typically when such eHealth kind of programs start, the end goal obviously is that you are not going to ignore your private sector, right? Because when you look at health statistics for a state, you are just not looking at a public health statistics, but you're also looking at private health statistics. Now, okay, I have 3 more minutes, okay. So basically, as time goes on, you may want to give access to your private health providers to key in key data which is going to help you come up with a state level health statistics. So you may want to give this application as a cloud offering to your private health providers, so they're able to kind of go and key in that data which is then going to be available to you to come up with state level statistical reporting. So your application should have multi-tenancy, should be able to be on a cloud. We have talked about the ability to work on an offline and online mode, but I think one important criteria here is when an application is in offline mode, it should have the capability to do an automatic synchronization with backend as soon as the network coverage or the mobile coverage is there. So when you're looking at an online and offline, just don't look at that. I think you should look at the automatic synchronization whenever the mobile coverage is there. We were talking about providing mobile solution to the ALMs. A lot of us were talking about that. Why don't we explore a solution wherein we let the ALMs continue using the paper or the template that they have currently, but the system still has the capability to send data in a digital format to a backend server in a way wherein you can still mine that. So we have a digital pen. This is in collaboration with an organization which is in Scotland, wherein this is not a traditional digital pen wherein you write with the pen on an A4 size paper and it does a picture, it creates a picture image. This one actually creates an XML output. So what it means is that your ANMs, they can continue to use the current paper templates that they have, but the system throws back data in a very meaningful manner back to your systems so that you are able to do data mining and reporting accordingly. So these are the kind of, I think, innovative solutions that we really need to look at instead of mobile, which is anyways everyone talks about it. How many more? Because I have 4-5 points running. Okay. We again talked a lot about mobile architecture. Everyone talked about mobility, right? Now, I'm sure you will want to look at a mobile architecture which is agnostic to either Android or Microsoft. You may not want to get a mobile architecture for you when you get stuck with an Android or get stuck with a Microsoft or third-party thing. So when you are deciding on your strategy for or your purchasing thing for mobile architecture, then you need to basically look at an application which gives you an agnostic view across any platform that is there. Same thing about BI capabilities. Now there are many BI solutions out there, right, wherein the large data that you are going to capture in the application, obviously it will do a reporting in terms of the historical data, but what about the predictive analysis? Because when you say that I'm going to do a disease modeling, right, and then figure out what is the predisposition for a particular disease, then you actually need a BI solution which can do a predictive analysis. So while deciding a BI tool, you just don't need to look at I would say the data analysis part of it, but then you should also look at a predictive analysis part. Performance and capacity management. So we all know that resources are always going to be scarce, whatever, and the way our population is we are always going to be in a catch-up mode. So in a scenario where the resources are always, last 1 minute, wherein the resources are always going to be scarce, we need to have the ability from the application to give us reports on how each resource, whether it is human, whether it is equipment, whether it is a situation of drug stock out, so each store, how it is doing. So to be able to do a